Hello, everyone. Welcome to Winthrop in the World. I'm Paul Baskin, and with us today is Meredith Hurley. Meredith is the health director here in Winthrop. Meredith is also, by the way, our first guest in this. The program is now a year old, and you were our first guest a year ago.
So interesting. I know.
Thank you for that. Thank you for coming back.
Happy to be here.
Yeah. So a lot going on in the world of health, certainly in town and nationally. I mean, obviously, we're hearing talk about healthcare premiums going up substantially for people. Do you even have a sense, first of all, how many people in Winthrop are on the government with ACA, the Affordable Care Act in the town, or just a rough sense?
I don't have a rough sense. I'm not quite sure. I could definitely probably pull some of that data, I think, but that may also be with the impacts that we're having of data being kind of scrubbed or warehoused, not publicly available.
Right.
I'm not as confident that we'll be able to easily get our hands on that kind of information about who's utilizing the Affordable Care Act as it was written here in Massachusetts fully.
Yeah, so there's that. There's also the issue of the SNAP benefits, although that may, by the time this airs, that may be settled because they're just in the process at the time we're doing this of reopening the government. So I guess I'm just sort of get a sense maybe these two issues and maybe the others in terms of what's coming from the federal government. How big an effect are you seeing these having on people in Winthrop?
So for the SNAP benefits, just for context, we know that there's about 2,100 residents that currently utilize SNAP benefits to.
We should tell people it's the food.
Oh the supplemental nutrition. It used to be kind of coined food stamps, or so it is. So we have about 2,100 residents that currently are enrolled in that program. So we were definitely in a panic mode as this situation was evolving, how we were going to be able to support folks with the urgent withdrawal of the benefits that they were used to receiving. So we've worked very closely with the food pantry and also regionally with Revere and Chelsea. We have a food collaborative that we work on with them that we've been doing for about a year now. So thankfully we've had that support system as well. So as it stands right now, the state of Massachusetts has funded fully for the month of November SNAP benefits. Okay. That had been decided prior to the Supreme Court's recent ruling that that states should not be funding SNAP fully for this month at the behest of the federal administration, but our Attorney General's office has kind of ruled against that in a way and said that. While the legal kind of wrangling is going on as to who's right and who's wrong, they're funding it.
Yeah, so I mean the SNAP one presumably will be solved, it sounds like, for now. But the healthcare one, I guess, so it's harder maybe to know the numbers in Winthrop, but I mean, do you have a sense as to how big an effect it could have on this town if they're talking about healthcare premiums doubling for people in this population?
Yeah.
What that would be like? What effect would you, as the health director in Winthrop, expect to see from that?
Well, I think it's going to really impact those folks that are in the percentage of the poverty. You know how it's calculated with it being that you qualify for different levels of the Affordable Care Act based off of what your annual income is, and it seems like for folks that are in that mid-range, maybe not at the lowest, we're talking like 300% of the poverty level, maybe somebody that's at 100% of the poverty level, but is still working a part-time job or doing things like that. It feels like they may be getting hit hardest because they're going to get a much higher increase. And there's going to be a lot of, the guidance documents haven't been very clear that have come out. So again, we're waiting for like a solid policy brief to say what are we expecting here. I think that it's hard to imagine that folks will become more dependent on an emergency care of systems than they were before, meaning, high utilizers of emergency rooms because they're, unable to afford the premiums or they're unable to afford the deductibles and things like that. I'm not really we take it one day at a time.
Right. No, I can imagine. Another issue, of course, is the funding that the town gets overall from the state, and the 3A housing law has become an issue there. I gather, in terms of the grants that the health department and sort of the overall health situation in Winthrop is affected by state grants that are tied to 3A. What's your best sense of what's going on there?
So right now, we currently hold one youth mental health improvement grant that is not impacted by 3A because it's under contract anyways. So, and then we were waiting for some guidance on our equitable approaches to public safety grant, which that one may be impacted. Right. But we're awaiting some guidance on it. We are not currently in movement of trying to secure like a new contract for a new grant necessarily, right. But we are going to have to be extremely strategic going forward as to where we're putting our efforts for applying right. For grants. We've done some municipal matching grants through the Opioid Mitigation Fund, okay. But we haven't necessarily been asked if I know that there are certain other grants in town that there's a question whether or not you're complying with 3A.
Right. We've gone on enough for people who don't know. 3A is the state housing law, and the Winthrop is not in compliance with the zoning requirement there. And the result of that is that there's certain state grants Winthrop is not eligible for. I understand that a lot of your department is fundamentally funded at the state level, but do you know to what degree that sort of threatens your overall ability to operate as a department?
I think it's going to threaten it significantly beginning in fiscal year 27. So beginning in July 1, we will, because we will be sundowning on 2 additional grants, and that is going to put a lot of pressure on the health department. Number one, to find supplemental grants, mostly through the state, that could help augment those gaps. Right. We're right now about 80% funded in grants, and about 65% of those are state grants.
And just so people know, what are some of the main things that your department does for the town of Winthrop that they might see affected by this potential loss in funding, if that's what you're talking about?
Yeah, so we have a great group of people on our team. So we have 2 peer recovery coaches that work in the sphere of any sort of addiction work. We have a social worker who is very all-encompassing. She works in anything related to mental health, but also crisis intervention, kind of the social determinants of health. She's also our clinical supervisor. So she really functions right, I would say, next to me, not even in a ladder, in a vertical sense. But so she really brings in a lot of the clinical pieces, and we have 2 resource coordinators that work very closely with anything related to heating, housing, food security. They're working a ton right now around food security. They're picking up jackets before the cold months, like to distribute to folks that might need them. Anything where folks are in need, they're working with that population too. Right. So, we only have 2. My position, our program manager, and a portion of one of our peer recovery coaches are funded through the municipal budget. Everybody else is grant funded, so we could potentially lose 6 positions.
Out of
9.
That would wipe out the health department in town. Okay. Okay. I mean, just listening to you go through the list of things, I mean, a lot of what you're referring to, I think it fits under the auspices of what's known as the CLEAR program. It sounds like in town. For people who don't know, is it unique to Winthrop, or is it, or how would you, well, first of all, what it is, as I understand it, it's for people who have drug addiction issues, and you basically help them recover rather than maybe arrest them and put them in jail?
Yeah,
is that
exactly. So that's
what
yeah, exactly. So it's the Community and Law Enforcement Assisted Recovery Program. Okay. So it started off, it was born out of the opioid epidemic and in response to the opioid epidemic. So, but we have definitely modified what recovery is the definition of now. Like, we are often talking to people who are recovering from housing instability. We're talking to people that are recovering from a mental health crisis. And our goal is at the core is to keep folks that may only have an option of interacting with law enforcement or emergency services, to divert them. It started off as a diversion program, divert them away from the criminal justice system. But now there's a new term that has been coined in the last few years, and it's called deflection. So we want to, even before it rises to a point of a crisis, we want to offer services that for residents, so that it doesn't rise to a crisis. Because we see folks that may be experiencing, for example, a risk of homelessness, and that homelessness is because they're behind on their rent, but they're behind on their rent because they had an injury and they no longer can work, but they don't know how to apply for certain programs. And so if we can keep that person stably housed and moving forward, that's what we try to do.
So the CLEAR program is very much a cooperation between your health department and the Winthrop Police Department.
Yeah.
That's right. And you guys just won an important award, right? I understand the 2025 National Law Enforcement Summit gave you an award for what?
For community leadership in community policing for small jurisdictions.
And what did you do to earn that?
So what we didn't realize, so Lieutenant Jajarian from the police department, so he, we were nominated, I think, by a few different organizations for the work that we do, and we didn't realize until we were in Denver, which is where the award ceremony was, that there were hundreds of folks that were other jurisdictions that were also up for this award. So we were at the International Association of Chiefs of Police conference, or like their annual meeting. It is the largest convening of law enforcement definitely in the United States, potentially in the world. There were police departments from the Middle East, Israel. There were police departments from all over the world that were there. And so it was sponsored by Walmart. So we were recognized for being 10 years of doing diversion and deflection within the community.
So we hear about this going on around the world, around the country, at least in different places, but what are you guys doing that's so seemingly ahead of what other communities in the country are doing?
Great question. So I think number one, we've had really strong leadership here. It started with Chief Delahanty and now has been passed on with Chief Goodwin. We have a great collaboration with the fire department as well, beginning with Chief Flanagan, and then now with Chief Calandra. So we work very closely with, I think that's what's unique to Winthrop, is that, and one of the things that is very different in Winthrop is that we have, in the health department, we have access to look at the police reports. We had to do a background check and things like that. And it's only myself and our social worker. So as we're reading through that, we're able to kind of flag matters for the police to go out and follow up on, things that in our experience could be, we call them almost quality of life issues, but not criminal issues.
So signs that somebody's getting in trouble or crisis, essentially.
Yeah.
The police, I can understand. What's the fire department? How does the fire department?
Oh my gosh, they're like the eyes and ears also. You think about, and they, for example, they may go in if there's for a fire call, exactly, right? Like a fire alarm is going off. And they might see somebody that is, starting to clutter a bit, and they're starting to have, and what we've historically called as hoarding, like I call it a high clutter content, is, that's really so rooted in mental health versus, it's not really a choice for somebody, it's a compulsion. But it poses significant safety risks to the individual, the community, if they're living in a apartment building, the neighbors, like all of that. And so you have to balance all of it.
And I understand you're also doing somehow this work involves Boston University researchers. What's that about? What are they learning, and how does that come back to the town of Winthrop?
Yeah, so about 7 years ago, I reached out to all of the surrounding universities here in Boston to build the capacity of the health department here in Winthrop. And the way that I envisioned it was to utilize graduate students, undergrad students. Part of the curriculum of getting a public health degree is that you have to have a practicum experience. And so I began working with Boston University. They were the only people that called me back.
Right.
So I started working with them, and we utilize at least 4 to 6 graduate students every year.
Right.
And they do a myriad of work. Right now, one of the main projects that they're working on is doing stakeholder interviews around adverse childhood experiences for...
Term stakeholder. Residents in town? Yeah.
Yeah, so we created a list of folks that work with youth in all different capacities, and we've asked them to sit and do a interview with an external evaluator to gain their insight. And it's great for me because I get a de-identified report of what folks are seeing for their needs. And this one is around adverse childhood experiences. And because, we know kind of what to do with like one moment, like one crisis that maybe a young person is experiencing, but we don't know what the collective impacts are of kind of this burden that can build up for kids. And the health outcomes for children in particular that have had multiple adverse experiences as their health outcomes are usually significantly lower. So we're trying to figure out how to kind of counterbalance that with more positive experiences for kids to buffer it.
So you're talking about children. So what's your relationship with the school department, Winthrop? Is there a pretty close relationship there, and what does it look like? What do you do?
Yeah, we became very close during COVID, so we've maintained that relationship. So we right now for the health department, we're more of a consultant if they need it. They have some excellent programs throughout the public schools, and we work almost as a triad with Winthrop CASA, and
CASA is
the Community Action for Safe Alternatives, which is the youth coalition here in Winthrop. And so we work in a triad, anything related to youth or prevention.
Right.
CASA is a nonprofit that does prevention work.
Right.
The schools are often doing more of the tertiary, so they're intervening in certain aspects, and so we're always working in conjunction and trying to support each other.
Right. What would you? I realize tough to answer this maybe too clearly, but what would you say is the overall health of the children of Winthrop these days? What do you see?
I think that our kids overall are very healthy. I think that it's a different world than when I grew up, and I do think that we're going to see some. We're already starting to see the emerging impacts of, number one, the introduction of social media. And it's also interesting, like vaping has been a huge concern, and now it's going into more of the smokeless tobacco, which like Zins or their access. And also another thing that's coming up is that's getting some traction is online gambling.
Really? Among school children?
Yes. So those are all, but I think overall we have good healthcare access.
Right.
We have, even though we don't have a lot of pediatricians here in the community, we definitely have access in the surrounding communities. And Winthrop is we've notoriously had a lot of social cohesion, meaning if there's, people are very vested in the youth here.
Yeah. So one thing that makes me think of too, some of the things, the students gambling and maybe and vaping and that kind of thing, it sort of calls out at least for some degree of education for these children to learn. But I know when you talk about schools, often the answer is yes, we'd like to do that, but we just can't fit it in with everything else we have to teach them.
They have a lot of mandates.
So what's that look like? Is there a situation where you and the school department are saying, yeah, there'd be a really nice class to have, or something we'd like to, but we just can't, or like what? How does that help us understand what that looks like?
Yeah, I think that they are mandated by their curriculum so much, and we one of the things that we try. What would be ideal is, it's really at the middle school and high school level that everybody seems to want to put education in, but how do we make it more encompassing in the lower elementary schools, right? Of like, especially around the social media piece. And we had a really interesting conversation with some youth a couple of months ago, and one of the things that the feedback that they gave us was, it's really great when you come in, and talk to us, but we're really not going to listen to you.
Okay.
And they said, and they were kind of 17, 18, 19, and they were like, what their suggestion was to train them to be able to go in and speak to the younger kids, because they feel like their experience would be more beneficial. So we'd love to do that at some point. But you're right, like the time in learning that is mandated for the schools is definitely hard.
That's what I'm wondering, is if it's a case where you kind of know what would be good to do, like you gave that example, but some of these things, but you just can't do them because of what? Because of time of the day, because of cost, because of something else?
I think it's less about cost and it's more about time in the day. So what we have done, and we continue, one of the things that we've been trying to do is work with kind of the secondary folks that are involved with youth. So for example, CASA facilitated a training. It was paid for by the health department on mental health and bullying, and we did this training with all of the high school coaches to recognize maybe the more subtle signs of emerging mental health stress within youth and or bullying, and what are the factors, but what can they do? Who do they refer to? Like, what are some steps for that? So we're looking at kind of the youth providers that maybe aren't the teachers or aren't the primary folks that we normally think of, but are interacting with our kids on a consistent basis.
Right. A lot there. You also, when you talked about the CLEAR program, you talked about it sort of having origins with opioids. I think when you were on a year ago, we talked about the fact that at that point, opioid use numbers in Winthrop were going up.
Yeah.
What's it like right now?
So our numbers are low. I think that we have had one confirmed fatality from substance use so far this year, in this calendar year. So, and one's more than we would ever want, because obviously one sounds like a success, but when we're talking about somebody's loved one, it's definitely not a success to them. But so, and that's something that I would love to dive more into with our research that we do with BU, of what was the facilitators last year, what's different, are there any indicators? Did we do anything different? Was it something that internal or external? So these are all kind of probing questions.
Is it pretty much Winthrop is a town in a big country. Is it really the case that Winthrop can sort of control that, or is that much more a function of what's going on in the wider community nation around us?
It could be. I think that the age demographic that we were looking at last year was like it varied. It was kind of the gamut. One of the things that we did suspect, and I think that we spoke about this, was that there were a lot of, not a lot, but there was significant activity with counterfeit pharmaceuticals in the area. I don't know if that's changed very much, but I know that there was some significant enforcement with the DEA and various task forces in kind of the hot spots that aren't sitting in Winthrop particularly, but surround us.
Right. So was it a few months ago you started a health survey in Winthrop? I guess you were reaching out to the people of Winthrop and asking them to voluntarily participate. Can you give us a sense of where that stands and what you're learning from it, what you hope to learn from it?
Yeah, so we just passed on some of the most recent data to BU and also to our epidemiologist that we work with within Winthrop, Revere, and Chelsea to kind of look at the information that we've gathered and kind of analyze it. They do a much better job than I know how to with kind of what they call slicing the data and looking at it not just as the numbers themselves, but what are the difference between demographics and things like that. And then we're hoping to host some listening sessions of, what we see from the initial data. Right. One of the things that has been prioritized within the region is the cost of living, the cost of housing. Right. Also, I think the second emerging concern was mental health, right. And also folks having the ability to access healthcare in a way that is, I wouldn't say convenient, but is time sensitive.
Right, okay. Is there anything that you would say is like your biggest question about the health of the people of Winthrop that you think might get answered to a better degree than we have right now?
I think being able to look at, so one of our biggest challenge here in the state is that we don't have access to large warehouses of data that we should have access to, and there's a massive delay in data that is being produced or looked at. So, for example, the cancer incidents right. in Massachusetts have not been reported in 8 years.
Okay.
So that would be great if we knew what the incidence of cancer is,
right.
different cancers, and by demographics. So we're right. very delayed in the data. So
like if there was a hot spot of cancer, I mean, I know I grew up just north of here when there was a hot spot, and it turned out to be from a tanning factory. There was a movie made about it, for that matter.
Yeah.
If that were going on right now in Winthrop, you wouldn't even know it was happening?
No, no. And so that's like our struggle. So what we're trying to do here in Winthrop is build up our local capacity for modernizing some of our data access. So I would love to get my hands on more quantitative data than what we're able to derive just from our surveys. And it's definitely out there, but we're unfortunately stagnated. So I would love to answer that question in a better way. Yeah. But one of the things that has emerged for sure is folks are having a harder time getting into primary care physicians, accessing primary care, and accessing more specialized, for example, the dermatologies and neurology that have long wait times.
Yeah, matter of fact, well, because even right at the beginning of the show, I asked if you could tell us how many people in Winthrop are on the Affordable Care Act, and you don't know that. So you don't even. So you're the health director in town and don't even have access to data that tells you.
Right.
So that would presumably have. You talked about the solutions to that. In terms of maybe getting more donations, or the fact that you talked about the fact that people will show up more in emergency rooms. I mean, I'm just sort of just to get a sense of what something like that would look like a year later if we do double the cost of health care for these people.
Yeah, I think that folks, even with our health survey, one of the questions that we ask is, have you chosen not to, what is the barriers to accessing healthcare for you? And I think one of the top 3 answers was the cost of accessing healthcare. So I can imagine that will probably go from a top 3 to potentially the top reason why folks are not able to access healthcare regularly or when they need it.
Yeah. Okay. I just want to ask, West Nile virus was an issue a while ago, I guess. I mean, what is it? I mean, right now it's getting to winter, so I assume it's not an issue. But just sort of what's the situation with that? Yeah.
So we work with the Northeast Mosquito Control and DPH. So they test, I think, 5 sites in Winthrop every week. So we get arbovirus reports every week during the season. So yes, luckily we are past what we call the vector season. I think we probably haven't had a hard frost, but we should have one in the next few days
Yeah.
to knock out the rest of the mosquitoes.
Right.
But we are marshy and swampy in some areas, so I think that that's where we see it. And we saw more West Nile and surrounding communities this year than we did here. But you know, it's like when you can see that there's, you know, a positive pool in Revere,
Right.
probably assume that they might be positive in Winthrop.
Well, maybe the way to ask is, I mean, it's going to probably come back each season. Is it your sense it's going to become a recurring problem and an increasing problem, and what, if anything, to do about it?
Yeah, so I mean, the best that we can do is just encourage folks during the height of the season to use insect repellent,
Yeah.
just kind of monitor and just you know, just monitor, like if there's standing water and things like that. Wear long sleeves if you're outside at dusk or dawn,
Right.
things like that.
And just one other, I mean, we're almost out of time, but one other thing, we sort of got to this, but never really hit on it directly, a lot of these issues, but the immigrant population. Winthrop has a growing immigrant population, matter of fact, faster growing than most cities and towns. What does that look like to you from a health concern perspective? Is it, you know, in terms of reaching out to a population that'd be harder to reach because of language barriers, because of maybe suspicions, especially in the era we're in right now with the federal crackdown? What does that look like to you from your position?
At baseline, I would say that we're hearing more fear within the immigrant population, that they're questioning, like, their freedom of movement. I know that in the city of Chelsea, they've seen a reduction of kids, for example, that are attending school.
Right.
We're not seeing that here, but we are concerned for that fear that can come, and what people are not doing because of that. Like, was part of the conversation as we were planning for a potential SNAP shutdown.
Right.
Would an immigrant family feel comfortable going to the food pantry?
Right.
Which our food pantry is wonderful here,
Right.
and that was also on their mind,
Right.
because, you know, there's been stories of targeted enforcement around places that maybe immigrants, our newcomers, would congregate initially. So.
What are you doing? What are you and can you do about that?
So we have a really nice relationship with the LPAC, which is the English Learner Parent Advisory Council. So it's a group through the public schools that have newly immigrated here and are just starting to learn English. So we work with the school liaison a lot, and they give us kind of that feedback, and then we try to counter that with direct messaging, translation, you know, translating our messages into Spanish, Portuguese, Arabic, to make sure that folks feel like they have a sense of what's going on. And I mean, we have a wonderful relationship with law enforcement and also the fire department, and they've spoken at LPAC meetings.
I see.
Yeah, to assure folks that, you know, nobody's here to arrest, you know, like, please continue. One of the fears, what prompted us to even pull together this group was, you know, we were worried that folks wouldn't call for help when they really needed it. Like, if there's, you know, a sick child that really should be going to the emergency room, would people hesitate to call for help?
Right, and you feel like the police and fire in Winthrop have done a good job of reaching out to that community and assuring them, and that's working?
Yes, it seems to.
Is there anything else that this group is saying that we could do? Because I mean, I know in some cases there's been talk that people in the migrant community would rather you just don't talk about it because media attention is bad attention. I'm just wondering what you're sort of getting in terms of what else both the official Winthrop and everyday citizens in town could be doing differently that would be more helpful.
I think that's a great question, because I think that that's where, like, the balance comes in that we're trying to strike of having a targeted communication or maintaining that open lines of communication, but also not continue to do some fear mongering that happens around the strife that seems to be surrounding this issue.
Yeah. Okay. So it sounds like overall, given the circumstances when things feel maybe about as good as you could expect at this point. Yeah.
Yeah.
Okay. Well, we are out of time. It was so great to talk with you
Yeah, it was
again.
great
So
to
many
chat with
important
you
things to hear from
too.
you. Thank you, Meredith. Again, Meredith Hurley, the health director here in Winthrop. Thank you for your time.
Thank you.